Why do we get a stiff neck? Stiff neck symptoms. Neck stiffness, stiff neck, and nuchal rigidity are terms that are frequently used interchangeably to describe a medical condition that occurs when one attempts to turn, move, or flex the neck and experiences discomfort or pain. Muscle strain or sprain, cervical spine disorders, meningitis, and subarachnoid haemorrhage are all possible causes. Most people have heard of it and are familiar with the discomfort and pain that comes with a stiff neck, whether it appeared when they woke up one morning or developed later in the day after some strenuous activity. Pain and stiffness usually go away on their own within a week. However, how a person manages and treats stiff neck symptoms can have an impact on pain levels, recovery time, and the likelihood of recurrence. The severity of a stiff neck can range from annoying discomfort to extremely painful, sharp, and limiting. Attempting to turn a stiff neck to a specific side or direction usually results in excruciating pain, necessitating a halt to the motion. The degree to which neck motion is reduced can have an effect on an individual's level of activity. Driving, for example, may be difficult until symptoms improve. If the head cannot be turned significantly in one direction without excruciating pain, driving should be avoided. Common causes of stiff neck. The most common cause of a stiff neck is a muscle strain or soft tissue sprain. The levator scapulae muscle, in particular, is prone to strain. The levator scapulae muscle, which is located on the back and side of the neck, connects the cervical spine of the neck to the shoulder. This muscle is controlled by the third and fourth cervical nerves. The levator scapulae muscle can be strained in a variety of ways, including maintaining an abnormal position of the neck for an extended period of time, sleeping in an inconvenient position, turning the head from side to side repeatedly during an activity, such as swimming. Neck tension can be caused by excessive stress or anxiety. Slouching with poor posture while looking at a computer monitor or looking down at a mobile phone for long periods of time, which is commonly called text neck. Rare causes of a stiff neck. Neck stiffness can be caused by a problem with the cervical spine, which supports and moves the neck, while also protecting the spinal cord. Among the cervical spine disorders that can cause painful spasms or tightening of neck muscles are cervical osteoarthritis. Arthritic breakdown of the cervical facet joints between vertebral bones occurs frequently in conjunction with other degenerative conditions, such as spinal stenosis, and anatomical changes, such as bone spurs. Cervical degenerative disc disease. Discs can lose hydration and height over time. Pressure on nearby joints, nerves, and soft tissues like ligaments and muscles increases. This procedure can cause neck pain and stiffness. Cervical herniated disc. The protective outer portion of a cervical spine disc degrades, allowing the inner portion to leak out, causing compression and inflammation in nearby tissues. Other possibilities may include such things as an infection or tumor.
Do not stop taking any prescribed medications or treatments without consulting your doctor. The materials and the information contained on this channel are provided for general and educational purposes only and do not constitute any legal, medical or other professional advice on any subject matter.